Hello, everyone. My name is Tracy. My position here at the hospital is Nurse Navigator. I am a contact person for you. Any questions that you have before you come in the hospital, while you're here in the hospital, after your hospital stay, you can call me. My phone number will be at the end of this presentation, and I can give it to you. It's 860-358-8580. I will be sending you all a packet of what I'm going over here today for your total shoulder replacement surgery. So we will get started. I've been here at the hospital for 18 years. I'm an RN. I've worked in orthopedics the whole time I've been here, and I was a floor nurse for 9 of those years. So I took care of patients just like yourselves. So I'm going to be going over the packet of information, like I said, that you'll receive in the mail. And if you have any questions, you can certainly call me. So when you come to the hospital, your surgeon is going to be doing your surgery. Your aftercare is going to be a team. The team is going to consist of a medical doctor called a hospitalist at the hospital, a case manager, an occupational therapist. You may or may not see a physical therapist, your primary nurse, and so we're a team, and a physician assistant. The physician assistant works with your surgeon. So of course your surgeon's going to do the surgery, but then the team is going to take care of you afterwards. Most patients will leave either the day of surgery or the day after surgery, and usually it's by noon. So try to have a ride ready by noon, because that's the way it works best. You'll be ready to go by the next day. Of course, we'll make sure that you're safe and that you understand all of your information before we let you go. So just another thing that I want to go over with you. We have an opportunity. We have partnered with Nutmeg Pharmacy, and it's just Nutmeg Pharmacy because they're the ones that partnered with us. The hospital does not make a profit from this, but what is really nice about Nutmeg Pharmacy is that you would be taking home, or they would come into your house and deliver all the medications that you would be taking from the hospital. This is normally what we send patients home with. And so this is not any of your normal medications. These would be medications that you would be getting from the hospital. What's nice is they'll pre-package the medications in a 7-day package, such as this. And it takes the worry out of how to take the medications from the hospital. You already know how to take your own medication, so you'd go back to taking your medications the way that you normally do. But the medications that you would be taking home from the hospital would be in a package like this. And if you see in this package, this is 7 a.m., 8 a.m., 3 p.m., and bedtime. So if you are interested in using this, then you're going to have this paper along with the packet of the information, and Nutmeg's phone number is right down here at the bottom. So if you can pre-register, it just makes it easier. There's 4 Nutmeg locations, so depending on where you live, depends on which one you're going to use. So if you call this number, they will tell you which one you can call. But like I said, they'll deliver your medications within 4 hours of you leaving the hospital, and it's all prepackaged. Now, don't worry, you don't have to be a Nutmeg customer. You don't have to become a Nutmeg customer. This could be a one-time thing, just the medications that you would be taking home from the hospital. If you do need a refill in the future, you would go through your own pharmacy if you want to. So you would be calling the surgeon's office anyway, and then you would be telling them which pharmacy to send the medications to. So you're not switching over to another pharmacy unless you want to. And this would be more for a one-time event if you wanted to do that. Now, in this prepackage, the pain medication would not be included because we want you to take the pain medication as needed. We just don't want you to take it in the package. So you would have that separate in a separate bottle, and then you would be able to take that medication as you need it. Okay, so I'm going to go to the PowerPoint presentation, the packet that I sent you in the mail, and then we're going to go slide by slide so you can follow along with me. Okay, so I'm going to present right now. Okay. All right. So the objectives of this class are, I'm going to teach you what to expect before, during, and after your hospital stay, how to prepare for your surgery, for yourself and your house, for your return following surgery, and who you can call if you have any questions, which is myself. So pre-hospital plan. You're going to need to get a physical exam of some type before you come in for surgery. You can either go see your primary care physician to get that physical exam, or you could be going to see the peak APRN to get that physical exam. Now, some of you might be going and getting your physical exam with your primary care doctor and getting a peak appointment. So you're not going to get a total physical exam again if that's the case. In that case, the peak APRN is just going to make sure that we have all your information gathered and that you're ready for surgery. Just know, if you can possibly get that physical exam as far out from surgery as possible, that would be a great idea, because in case they find something that it either needs to be further investigated or you need to have something changed, we want to have that time to do that. So if you've had a physical the day before your surgery and they find something, that would not be good. So that's why getting it as far out as possible is a good idea. If you have a specialist, such as a cardiologist, pulmonologist, endocrinologist, you may or may not have to go see them, depending on when the last time you saw them, what your current medical condition is. Someone would let you know if you do need to do that, whether it be your primary care doctor or if you're at your peak APRN. So just plan on that if you haven't seen your specialist in a long time and it's someone that follows you pretty regularly. EKG. Most of you will need to get an EKG, not all of you, and you will know that. Someone will tell you that if you're going to your primary care doctor, you'll get it done there. If you're getting your physical at the peak APRN, you'll get it done there. Seeing your dentist. Now, we put that up here because a lot of patients will say, why did I need to go see my dentist? What does my dentist my teeth have anything to do with my shoulder replacement? Believe it or not, in the past few years, they've linked dental disease with heart disease or other types of problems. So we want to make sure that you are in the best physical medical shape that you can be in before you come in for surgery. You have a bad shoulder, but that doesn't mean that you should be a sick person with a bad shoulder. You should be a healthy person, or as healthy as possible, before you come in to have your shoulder replacement. If you think about it, when you get your teeth cleaned, they're scraping bacteria from your teeth and your gums are bleeding. If that bacteria gets into your bloodstream and seeds in your new joint, that would be a bad thing. So let's say too that you have an infection that you don't even know about, and you haven't gone to the dentist in 5 years and that infection seeds in your joint, that would be a problem. So when I was talking about the cleaning, no cleaning or any dental work within 2 weeks of your surgery because of that reason. So, but let's say 2 days before surgery, you have a terrible toothache. You need to go get it checked because you don't want to be going into the surgery having any type of problem. Okay, and there is a period of time you need to wait to go back to the dentist after your surgery, and that's going to be up to your surgeon. Sometimes they make you wait 12 weeks. So if you have an appointment right after surgery, you're going to have to check with your surgeon on that to make sure that that is something that you can do or can't do. And most of the time, you're going to need to take an antibiotic before going. So that's something you can ask at your follow-up appointment also. Visiting the lab. If it's at all possible for you to have your lab work done at Middlesex Hospital or one of our outpatient centers, that would be best, because it's easier for us to get the results back. But if you only can go to Quest or another lab because of your insurance, please do so, because we don't want you to get charged with something that you don't necessarily need to, okay? And you should try to have that lab work done as far out as possible too, because you want to make sure that if anything needs to be fixed or further investigated, you have that time. Nose swabs. I know it looks like we're checking for COVID, but we are not in this case. We've been doing this for a while. When you do go to the lab, they are going to take a Q-tip and they're going to put it in your nose. And then they're going to rub it across a Petri dish. What they are looking for is staph bacteria. Believe it or not, there's a lot of people walking around with staph bacteria in their nose. It's called colonized. Colonized means that it's living in your nose, but it's not causing you a problem because you're healthy. But if that staph bacteria gets from your nose into your joint, into your shoulder joint, that could be a staph infection, and that's a bad infection. So what they do, like I said, is they put the Q-tip in your nose, they rub it across a petri dish, and then they watch it for a couple of days to see if it grows any staph. They are looking for a strain of staph bacteria called MRSA also. So they'll watch it for either of those. If either of those grow, then you would be positive. They will only call you if you're positive, and remember, it'll take a couple of days. And if you are positive, they'll call you. The treatment is very easy. You will have to get a prescription for a cream that you're going to put on your Q-tip, and you're going to put it in your nose a couple of times a day for a certain period of time. If you are positive for that strain of staph bacteria called MRSA, you are going to get treated before you come in. But when you come to have your surgery, after your surgery, everyone's going to have to wear gowns and gloves when they come in your room. And the reason for that is our policy states that you have to have 3 negative cultures in order for us to deem you free of that MRSA, because it is more antibiotic resistant. So let's say you were positive for it, you're going to get treated. When you come in, everyone wears gowns and gloves when they come in your room. When you leave the hospital, you can always go back to your primary care doctor, get the scripts to go back to the lab to get the 3 negative cultures. Do you have to do that? No. But the problem is that if you're ever hospitalized in the future and you don't have those 3 negative cultures, everyone would have to wear gowns and gloves in your room. So that is up to you. And there is a certain period of time after the treatment and between each time you get tested. And so your primary care doctor should know that. Okay, so you will know if you have it or not. Everyone has bacteria on their body. We want you to be as clean as possible, getting all that bacteria off your body before you come in for surgery. So when you go to the lab, they're going to give you this bottle of Hibiclens or chlorhexidine. If you happen to go to like Quest or another lab, they are not going to give that to you. But that's something that you can buy over the counter yourself at any drugstore or any like Price Chopper, Stop and Shop. They have it everywhere over the counter. So we want you to do a clean your body for the 3 days before and the morning of surgery. So let's pretend your surgery is going to be on a Monday. You're going to do this wash on Friday, Saturday, Sunday, and then Monday morning. If your surgery is on Tuesday, you're going to do it Saturday, Sunday, Monday, and then Tuesday morning. Now, if you have to be here at 5:30 in the morning the day of surgery, then you can skip the morning wash and you can do it the night before. So for instance, let's say your surgery's on Monday, but you have to be here at 5:30 in the morning. You're going to do your wash on Friday, Saturday, and then do the Sunday wash at night, okay, so that your body is clean before you go to bed. So you're going to do that wash. And what you're going to do is you're going to wash so for the 3 days before and the morning of surgery. First thing I want you to do is I want you to get a bar of antibacterial soap. Dial makes an antibacterial soap. Safeguard is an antibacterial soap. There's one called Lifebuoy, whatever brand you want to use. I think Irish Spring makes one. But you're going to get yourself an antibacterial soap and you're going to wash from head to toe. Wash your whole body. Then you're going to rinse off. If you normally use shampoo in your hair, you can use shampoo, but wash everywhere with that soap. And then you're going to rinse off. Then you're going to do a second wash with this Hibiclens liquid. Now, it does not lather and you don't need a lot of it. Okay? You can use your hand to apply it. You can use a sponge, like a kitchen sponge. Please don't use the one you did your dishes with the night before or washed your counters with. This has to be a brand new sponge. So you put a little, let's say I'm using my hand, or you can use a face cloth, sorry, but it has to be a clean face cloth. So the one you stuck in your shower from the day before, you cannot use that again. It has to be clean in between uses because bacteria love warm, wet areas. And when you use it and you stick it up in your shower, you're going to get bacteria on it. So let's say I'm using my hand, I put a little on, And I'm going to do a gentle scrub in a circular motion, and I mean gentle. We had somebody scrub so hard their surgery had to be postponed. So neck down only. Okay, you do not want to get the Hibiclens on your head, hair, and face, and you don't want to rub it directly in your private area, front and back. You can wash your inner thigh, still wash your fanny, but just front and back. Don't get it in your private area. Spend some extra time that you're on the shoulder that you're having the surgery on, the whole front, back, and sides. Okay, once you're done, you're going to leave it on for 1 to 2 minutes, and then you're going to rinse it off. Okay, so in essence, you're kind of taking 2 showers in one. Now back to the instructions that you have. So for 3 days before, in the morning of surgery, you're going to take a regular shower using an antibacterial bar soap. That'd be like the Dial or the Safeguard. Be sure to cleanse your whole body and then rinse off. And then you're going to gently apply the Hibiclens liquid soap to your skin using a circular motion. Use a clean sponge or your hand to apply. Use a long-handled sponge for areas that you cannot reach. You want to wash from the neck down only. Avoid getting that Hibiclens in your eyes, ears, head, hair, face, and direct private area. Spend some extra time cleaning the shoulder that will be operated on. Let it stay on for 1 to 2 minutes and then rinse off. We kind of have that out of order, but the Hibiclens will be given to you when your blood work is done. But if you don't get it or you knock it over in the shower, remember you can get that over the counter anywhere. Okay. So a couple of more things with this. So if you use a face cloth today to wash yourself, get a clean one for the next day. If you're using a sponge, that needs to be cleaned, or you need to use a different one every day. And that includes the long-handled sponge. So if you're using a long-handled sponge, you can wash that in your dishwasher, or you can use a bleach and water solution, but it does need to be cleaned every day, okay? During this period of time, think as clean as possible. Use a clean towel every day. If you dry yourself and you hang up that towel, it's going to collect bacteria, and then you're sticking it back on your skin. So it has to be a clean one every day. Change your sheets before you start the process. So let's say you're going to start your wash on Friday. Change your sheets so you're sleeping on clean sheets on Friday night. Wear clean clothes. I think that's about it. So just think about those things and just make sure that you're as clean as possible. All right. Nutrition. Try to eat a balanced diet, including protein, vegetables, fruits, dairy, grains, and breads. Our government actually has a website, and the website address is right up here, www.choosemyplate.org. So they developed this website to tell you about how important eating. We used to have the food pyramid. Now we actually have My Plate, which the plate tells you how much of everything that you should be eating. Remember the old food pyramid where sugars and breads and things were at the top, meaning that you can't eat as much, and vegetables and fruits were down near the bottom. That's kind of the same thing with the plate. Now, important nutrients. So fiber is going to be, if you're questioning what types of foods, and these are the types of things that you should really be stocking your house with. These types of protein, vegetables, fruits, fiber. Fiber, why would you want that? Fiber actually is very good because when you've had surgery and you're taking opioids, constipation is a really big problem. A lot of people don't like to talk about constipation, but it is a problem. So what we want you to do is, if you're eating fiber and drinking enough fluid, that balance is really good. That is going to help your bowels. If you just eat fiber, you're going to have more of a bulky constipated stools, whereas if you're drinking enough fluid, that will help with your bowels. Now, how much is enough fluid? 6 to 8 8-ounce glasses of water you should be drinking every day. That's like half of a gallon. I know probably some of you will say, I hate water. Start flavoring it now. Even an orange slice will make a big difference. A lemon slice, a cucumber, or if you like something like Crystal Light, or you like anything that's not really sugary will help flavor your water. But start thinking about that now and how you can prepare for that. Okay, pre-surgical testing. You're going to get a phone call. Most of you have already gotten this phone call where they've asked the pre-procedure navigators are going to ask about your medical history, any allergies you've had, medications. Believe it or not, medications include anything over the counter, any herbal supplements, any prescriptions, any vitamins, any creams, not like a Lubriderm cream or a Vaseline intensive care cream, but like a cream such as a capsaicin cream or something that you have for eczema or psoriasis. It's really important to list all of that. You might say, why do I have to tell them what herbal supplements I take or over the counter? Those are just things that I can buy at the store without even a prescription. Everything has side effects. Believe it or not, vitamin E, fish oil, Advil, Motrin, ibuprofen, and Aleve all thin your blood. So your surgeon may not want you taking those right before surgery because they may not want you to go into surgery with having your blood thinner. So that's why it's important to list everything and then let us decide if it's important or not, or what you should be taking and what you should be stopping. And I will let you know that patients have told me that they never realized how much Advil, Motrin, ibuprofen, or Aleve was actually working for them until they had to stop it. So just realize that it might be working better than you think. And when you do have to stop it, you might want to see if you might want to check with your surgeon, see if you can be taking Tylenol or another type of medication in substitution for that Motrin. Okay. Please do not bring any medications with you to the hospital. We don't want you taking medications, the same ones that the nursing staff is giving you. Many times there's a discrepancy with the names of medications. So there could be a medication, or not that there could be, but there are two names for every medication. There's a brand name and then there is a generic name. So many times patients know the generic name and nurses know the brand name. So with the masks, with the shields that we've come to start wearing, a lot of times you may say to yourself, what medication is she talking about? Oh, well, maybe it's a medication they're giving me in the hospital, but they forgot to give me my heart medication, so I'm going to take it myself. We do not want that because it's probably, if there's a medication question, you ask the nurse, but do not take anything because you might have just gotten that medication. They might have been talking about the brand name, or it may sound mumbled and you are thinking that you didn't take it. You don't want to double take any medications. That just leads to disaster. You could fall. So please don't bring in your own medications unless somebody tells you to bring it in. Which pharmacy you use, that's important. Remember, if you want to use Nutmeg Pharmacy, you just tell them when you're leaving that you want to use Nutmeg Pharmacy. If you've already told the pre-procedure navigators, that's fine. And then when you're here in the hospital, if you decided you wanted to use Nutmeg, or let's say you told them that you use CVS, but you want to switch to Walgreens, that's fine. Because the physician's assistants are going to ask you what pharmacy you want your medication sent to, and that's the time to tell them the change if you want to make a change, and that's fine. And let's say you signed up for Nutmeg and then you decide you don't want to use them, that's fine too. You can tell them at that time what pharmacy you want to use. If you've ever had any anesthesia-related problems, that would be important to let us know too. And also, if you have, sometimes they're calling you 5 or 6 weeks out from your surgery. So if you have a medication change, maybe you went to see your primary care doctor and your blood pressure was really high or low. And so they've changed a medication. We need to know what that change is. So a good idea is to have a list of medications that you bring with you, an up-to-date list the day of surgery, and make sure that we have all of your medications correct in our system. Also, the next day when the nurse is giving you your medications, you can take out your list and make sure everything is correct. And if you have any questions, that's another avenue for answering questions. Again, though, you can call me. Hand hygiene. I know it looks like we put this up here because of COVID, and that is not true, but it is true with COVID also. Hand hygiene is the #1 prevention of infection. Everyone should be washing their hands. Staff, visitors, and you should wash their hands. We have Purell dispensers in the hallway and most of the patient rooms. You can bring in your own hand sanitizer or antibacterial hand cloths for your bedside. The rule of thumb is if your hands feel like they're soiled, if they feel like there's something on them, you really should try to use soap and water if you can. And when you are using soap and water, 15 seconds of the scrubbing is really good. If you don't have access to water, let's say you're in bed and they're bringing in your tray, you can certainly use the Purell to wash your hands. But just encourage everybody to wash their hands and make sure you are doing the same. And try not touching your face. I know it's difficult, but you want to try to keep your hands away from your face. Right now, our visitor policy, and that's of today. Today is November 10th. The visitor policy is you can have one visitor with you at a time, okay? And our visiting hours are 10 in the morning till 8 o'clock at night. So the visitors can come during those times only, but that is subject to change because of the way the state is going. And you can always call me before your surgery if your surgery's maybe next month and check and see what our visitor policy is at that time. But a visitor can come downstairs with you to the waiting room and sit with you until you actually get called in. And then they have the choice right now of either staying in the waiting room as long as the waiting room isn't at maximum capacity, or they can leave and come back after. We have what's called Family Touch here. What they will do is they'll get a phone number for your loved one, and if they have texting on their phone, the person would be they'll get a text message when you go in for surgery, while you're in surgery, when you come out. So they'll know exactly where you are through the process. This is what you're going to want to bring to the hospital. Insurance cards, picture ID. If you have a living will and you tell us you have a living will, you certainly can bring a copy of that. If you don't have one, you don't need to, but if you tell us you have one, we do need a copy. Loose fitting clothing. The best thing to bring in after your total shoulder is an oversized t-shirt or a button-down shirt. Not one that's really tight though, because that's what's going to be easiest for you. If you want to wear a bra, if you want to wear a bra, then you can bring a front closed bra. That'll probably be the easiest one to get on, and probably one that's strapless because you don't want that strap on your shoulder. Personal toiletries. If you can possibly not bring something, that's a good idea. Less is better in this case. But if you want to bring, if you really need to bring your own toothbrush and toothpaste, you can, though we have them here. Dentures, if you wear them, bring the adhesive if you have some. If you wear glasses, bring those. If you wear hearing aids, bring extra batteries in the case, even though you're not going to be here long. If you're on CPAP or BiPAP, please bring in your machine, your mask, your tubing, and your setting. Bring it all in. Okay, what to leave at home? Jewelry or valuable items. You really should try to take off all of your rings. You don't want, God forbid, your fingers swelled during surgery. You don't want them to have to cut off those rings. Don't bring in any wallets, credit cards, cash. If you have a copay the day of surgery, certainly you can bring in a payment for that, but then you want to leave that, have somebody bring that home. No cigarettes, matches, lighters. No hair dryers, curling irons. Please, like I said, no medications unless you're told to bring it. So the day of surgery, the front doors do not open till 5:30 in the morning, and that is world clock time. What does that mean? That means your cell phone. So your cell phone is set to the world clock. So if your watch says it's 5:30, but your cell phone says it's 5:20, those doors are not going to open till 5:30. So if they have you getting here at 5:30, don't come at 5 o'clock. Come when they tell you, because 5:30 is when those doors are going to open. You're going to come in the main lobby, and they are going to do like an infrared. They're going to be checking your temperature. You're going to go to the information desk. Okay, if there's no one at the information desk, you can go walk through the lobby, go to the right. There's a big red Wells Fargo ATM machine. Across from that are the south elevators. You're going to get in the elevator, push G for ground floor. The doors are going to open up on the ground floor. There's an iPad right across. You're going to go sign in on the iPad and then wait in the waiting room. They're going to come and get you, and then you're going to go in the back. You are going to do one last wash. You don't have to step into a shower. They're going to give you a packet of warm cloths, and they'll tell you exactly what to do when you're going to wash your body one last time. We also take Q-tips with iodine solution on them, and they're going to put it in each of your nostrils, whether you were positive or negative for staph or MRSA. They're going to put it in your nose, both nostrils, just to make sure everything is dead. Okay, you're going to put a Johnny coat on. They're going to start your IV. Before you go in for surgery, the hospital does a timeout procedure. They're going to go over your name, your date of birth, who your surgeon is, what surgery you're having done, and which leg they're going to do the surgery on. And then, which arm they're going to do the surgery on. And then they'll mark it. So if it's this shoulder, they may put their initial here. If it's this shoulder, they'll put their initial there, and they might put an X on the opposite one, okay? So that you know that the correct surgeon's doing the correct surgery on the correct patient on the correct arm. Special equipment, intravenous, that's a little catheter that either goes in your hand or your arm. It's going to deliver fluids. Usually you have 24 hours worth of antibiotics or 3 doses, whichever comes first. Okay, so normally you're not going to go home with an antibiotic, but you will have it for a short period of time. You're going to get fluids. You could get pain medication through that IV. And when you're eating and drinking good, we take that away. Oxygen, that's the little tube that goes in your nose. It's going to deliver oxygen from the time of surgery until you have a good oxygen level. We'll take that away. Wound covering. So different surgeons use different types of dressings or wound coverings on your shoulder, and we will talk about that while you're here, because it just gets too confusing if I talk about the different types and your surgeon does or does not use that. So we will tell you when that comes off, when you can shower, how to take care of that while you're here. Plan on, you should be looking at the area every day after the surgery, and once the bandage comes off, you can actually look at your incision. So plan to do that in your mirror, because it's going to be really important to have the same set of eyes looking at that area. Okay, foot pumps or leg wraps. Most of you will either come up to the floor with either the foot pumps like this picture or a wrap that goes around your leg. That helps to prevent blood clots. When you've had surgery, you're predisposed to blood clots, and when you're laying in bed or sitting in the chair, you tend not to be moving enough. And so blood clots could happen. So you're going to come up with either the foot pumps or the leg wraps on. They squeeze, release, pumping that used blood back up to your heart. So just make sure they're on you when you're in bed or in the chair, and they should be working. So be an advocate for yourself and make sure that you let them know. You're going to a wonderful floor. It's the orthopedic floor called South 6. All the nurses are trained in orthopedics, all the physical therapists, occupational therapists, patient care technicians. So you will get very good care on that floor. Exercising your lungs. Let me just go forward for 1 second. Okay. All right. So let me just go to this and then go back. So walking and exercises, I was talking about preventing blood clots, and this is kind of a picture of what a blood clot looks like in your vein. So you don't want that to happen. So we want you to get up and move, but we don't want you to be doing it by yourself. We want you to be ringing your call bell and asking for help to get up and move around. But we do want you to do that and walk, because that is another way it's going to prevent blood clots besides having those foot pumps or leg wraps. One thing that you can do yourself while sitting in the chair or laying in bed is called an ankle exercise. So hopefully, let me back up a little. The ankle exercise is pumping your foot towards your nose to the floor, nose to the floor. That helps pump the used blood back up to your heart. So that's an exercise that you can practice and do in the hospital yourself. I'm going to go back a bit. All right, another thing we want to prevent, a complication, is called atelectasis. What is atelectasis? Atelectasis is when your lungs stick together at the bottom. So if you've had surgery and you're not really moving because you're in pain, your lungs can stick together at the bottom. And what happens is we can usually tell when that first begins because you start to get a fever. That's not a good thing. So we want to make sure that you're deep breathing and getting that oxygen all the way to the bottom of your lungs and opening it up. So we're going to give you this machine called an incentive spirometer. If you look at the machine over here, there's 3 little ranges. There's good, better, and best. And you know you always want to be the best, so you want to keep it down in this range. So this yellow part you want it to stay down here. The white part, you want to try to get it up as high as you can. But the secret to this machine is slow and steady, not fast and furious. And it's quality over quantity. So if you can only get it up halfway, but you're keeping it in the best range, that is the best thing. And what you can do is challenge yourself. So if you get it up to 1500 the first time, maybe put it up a little. See if you can get it up a little higher. Challenge yourself. So I'm going to demonstrate this. So the way to use this is to breathe in, because you want to bring that oxygen all the way to the bottom of your lungs. So you're going to hold it for a couple seconds, and then you're going to breathe out. If you go fast and furious, it looks really impressive and it's good for your lungs, but it's not the best. The best is to keep it in the best range. Okay, so we're going to want you to do this 10 times an hour while awake. One thing I want you to practice before you come in the hospital is exercising your lungs, which will help you to be able to do that. And trust me, that is really not easy. I know I made it look easy, but I've been doing it for a couple of years now. So this exercise is called smelling the roses and blowing out the candles. So if you had a bouquet of roses in front of you and you were going to use your nose and do a nice slow deep breath in, you're going to smell the roses. Feel your lungs expand. You're going to hold it for a couple of seconds, and then you're going to blow out your birthday candles. Smell the roses, and then blow out your birthday candles. Try doing this several times a day. You don't want to do this a million times an hour because you will pass out. Don't do that. But try to do this several times a day. It'll be very good for you. Okay. Pain management. So we use here at the hospital something called multimodal pain management. What does that mean? That means that we use a variety or a mix of things to help with your pain. Okay, so one thing that we do right away is ice. Believe it or not, swelling is going to cause pain. And having surgery, your body doesn't realize that you did have this surgery on purpose. So all it knows is that it was cut into. So it is sending fluid in that area to try to help that area, to try to heal. So that's going to cause swelling, and swelling is going to cause pain. So ice is going to be your friend. Some of you might be getting a machine from your doctor's office, a cooling machine. Now with that, couple of things. Make sure that if you are getting that cooling machine, that you know how to use it. So if they deliver it before your surgery, take it all apart, make sure you know exactly how it works. Call them if you have any questions. I've had a couple of patients after surgery who waited and then the machines didn't work or they had trouble figuring out how to use it. So try everything before. They'll be there for your questions. You can ask and you can make sure everything's working. You don't want to come home from surgery and say, oh my gosh, it doesn't work, and now you don't have anything. So be prepared and make sure that you try it, it's working, and that all your questions are answered. Okay, so ice is going to be really important. all of the surgeons use what's called Exparil. So what happens is before they close up your shoulder, they inject in the tissue around the shoulder a medication called Exparil. It's balls of solution that sit in the tissue and slowly dissolve. It does take about 8 to 10 hours to actually start working and can last 2 to 3 days. Okay, now it's not going to totally take away the pain, just so you know, but it should help with the pain. Now, most of the surgeons also use a interscalene block, so that is going to totally take away the pain to begin with. So you probably will come out of surgery without having any pain, but everyone is different, and everybody's body reacts to the medication differently. So just know that you probably are not going to have pain right after, but if you do, then that's something that you need to let the nurses know. And usually with a shoulder replacement, these pain medications, these types of blocks work really well, and they can last a couple of days. But beware, because if it is working really well for you, it is going to wear off, and you need to make sure that you're going to be taking pain medication when it wears off, because it could wear off pretty quickly, and you do not want to be catching up with pain. Okay, you don't want to be chasing it after, because pain that gets out of control is a lot harder to get back under control. It takes time, it takes medication, and you're going to be miserable the whole time trying to catch up with it, and it's not going to be good. So when you're in the hospital, if you're having pain, you let the nurses know. They can come and evaluate you and see if there's anything that you're due for or what they can do for you. Okay, and when you go home, if you had really good pain relief in the hospital, just remember when you go home, it could be a different story in a day or two. And there is no, it doesn't wait till you wake up in the morning, the pain. It could be in the middle of the night. It just happens whenever it wears off. So be prepared for that. You might want to keep a pain pill by your bedside in case that happens. And of course, I had already talked about bowel care. Constipation is a really big problem. We usually send you home with stool softeners a couple of times a day. We use Miralax here, which is crystals that dissolve in water. And you can use that when you go home, but do not let your bowels, remember, don't let that. You shouldn't go more than 2-3 days at the most. You can stock your house with some prunes, prune juice. Some people say that prune and apple juice mixed and heated works really well. Somebody said prune juice and ginger ale. Why they tried it, I don't know, but they said that works really well if you warm it. Back to pain medication for just a minute. So you are going to be having these types of blocks that are listed here, but we also use IV Tylenol. And you might say, IV Tylenol, what good does that do? Actually, Tylenol is a good after surgery pain medication, but it works best if you use it around the clock. So we're going to give you a couple of doses of that, and then we're going to expect that you're going to go home and take the Tylenol around the clock, because keeping that little level in your body at all times is a really good idea. Even if you're getting pretty good pain control, you really want to try using that for the period of time that they prescribe it for you, because that may take the edge off when the pain medication, when the blocks wear off. So you want to do that. We also have opioids that we use. Some of the doctors are using either Celebrex or they're using meloxicam, which are anti-inflammatories. So you go home with a combination of medications. Preventing blood clots. Everyone is also going to be on some type of medication to prevent blood clots. Now, if you're already on a blood thinning medication, then you'll go back on it. So if you're on Coumadin or you're on Pradaxa or you're on Eliquis, you'll go back on those types of medications. All the surgeons are using a baby aspirin twice a day as a blood thinner. But if you're allergic to aspirin, or you've had blood clots in the past, or you have a condition that predisposes you to blood clots, you would go on something else, either usually Xarelto or Lovenox. Most likely probably Xarelto. So you will be on something for a period of time, and most likely it'll just be a baby aspirin, and that will be prescribed for you. This is the nerve block that I was talking about. It's injected in your shoulder during surgery, numbs the shoulder, used with anesthesia, usually lasts about 6 to 8 hours. But like I said, everybody's different. So your body may react differently. It may not last that long for you. So just realize that if you come up and you are in pain after surgery, you need to let them know. Okay, rest and healing. We do have earplugs, headsets, music channels. You just need to ask for the earplugs or headsets. Quiet afternoon rest. Like I said, most patients are leaving by the next day and usually by noon. So you should always have a ride ready, but we're going to make sure that you're safe before you leave. So your quiet afternoon rest would probably be in your own home. And remember, our visiting hours today, the 10th of November, are 10 in the morning till 8 o'clock at night. Just for you, room service. You have all-day dining with the ability to order between the hours of 6:30 a.m. and 6:30 p.m., featuring hot and cold items at every meal. We do an all-day breakfast. If you want an omelet for lunch, that's fine. The menu's adapted to your dietary needs. So let's say you're diabetic, you're going to have a diabetic menu, or heart healthy, depending on what your diet is. You're just going to dial 4488 from your room phone. You don't need to memorize this. That will be on your menu. And usually it's delivered within 45 minutes. My suggestion to you is to order your breakfast for the next morning if you're staying over the night before, because you're going to have more activity after 8 o'clock. The case manager is going to come see you, occupational therapy, physical therapy, if physical therapy is ordered. Your nurse is going to be giving you medications, the medical doctor, you're going to have a lot of people coming to see you. So if you eat 7:30, or even if you want to order for 6:30, you'll have some peace and you'll have something in your stomach before you're taking your medications. Going home, like I said, you should have someone be ready to pick you up by 12 on discharge day. Now, if you're leaving the same day as surgery, you're not going to be getting picked up at noon. Especially, we make sure that you are able to accomplish a few things before you leave, that you're steady on your feet, that you know how to dress yourself, that you're able to pee before you go, that the medications are working for you, that your vital signs are stable. And usually if you are going home the same day, you know about that before. So just know that we're not going to be kicking anybody out. It's usually patients that know ahead of time that that's what they want to do. So what you need to know to arrange for a ride home should be a car that's easy to get in and out of. And the staff is going to help you get in, but then remember, once you get home, that friend or family member needs to help you get out. So you really don't want to get picked up in a really high car or something really low that you're going to have trouble getting out, because you're not going to be able to use that arm that you had the surgery on. Okay, so there's two types of therapy in the hospital. There's occupational therapy and there's physical therapy. The physical therapist may see you just to make sure that you can, that you're not off balance and that you walk well and that you're going to be safe. But pretty much occupational therapy is the one that's going to see you most. So occupational therapy is concerned with eating, bathing, dressing. And since you're going to be one-armed, and depending on which arm, if it's your dominant arm, it's going to be, you're going to have more difficulty getting dressed, eating, and that type of thing. So that's what they're going to be going over with you. And even if it's your non-dominant arm, they're still going to show you how to get dressed and how you can accomplish some things. So what they're going to advise you on is caring for yourself at home, preparing for your return home, eating, bathing, dressing, and using the bathroom, how to wear your sling, and give you some exercises that you're going to be able to do at home. So caring for yourself at home. After you have the surgery, you really need to be keeping your shoulders still. They're going to show you some exercise. So let's say it's this shoulder. The shoulder needs to be still. Unlike a hip or knee, when you have a hip or knee replacement done, we want you moving it, not with a shoulder. You need to let that heal some before you do too much, because you need to let the work the surgeon did heal before you start doing your motions. Okay, so your shoulder needs to be still. We're going to give you exercises that you can do with your hand, that you can do with your wrist, that you can do with your elbow, but your arm should stay. You cannot rotate your arm out. You don't want to put your arm out. You don't want to put your arm in back of you. You do not want to use this arm, if this is the arm you're having the surgery on, for lifting, pushing, or pulling, okay? So that arm you need to do, and I will tell you, I've been here 18 years, the patients that do the best, because sometimes a patient will have a shoulder replacement and then come back for something else, like a knee replacement or a hip replacement. The ones that do what they're supposed to do have so much better motion. Patients have come in showing me how they can lift and move, and it's pretty amazing. So I'm sure you want to get the best motion out of your arm as possible. So it is going to be inconvenient for you, and it is going to take time, but it's really important to do it if you want to get the best motion. Okay, so that's caring for you at home. That's what they're going to be showing you. Preparing for your return home, it's really important to be safe and to make sure that you move items that you use every day to your waist level. Your kitchen, in the kitchen, the refrigerator, the bathroom, the bedroom. You don't want to be standing on things. You could be off balance. You don't want to be reaching. You don't want to be at all have any opportunity to hurt your arm. You want to pick up loose rugs and move furniture. This is before, so you have a clear path in every room. You don't want to fall. Arrange for a ride in a car that's easy to get in and out of. Have somebody stay with you for the first few days. That's really important. If you can have somebody there for the first few days, helping you with the medications. They shouldn't be helping you get up and down, but helping you with the medications, getting you food. A good suggestion is try to, and it might be on the next slide, but try to freeze healthy meals. If you can make a batch of something that's healthy and you can freeze it, but it should be things that are easy to cut, especially if it's your non-dominant arm. You want to be able to cut, but even if it is your dominant arm, you're not going to be able to use the other arm to be able to use the knife. So you want to be able to cut the things. So preparing for your return home, practice everyday activities using only the arm that won't be operated. So let's say this is my dominant arm, okay, and I'm having that repaired. So I'm going to want to try practicing brushing my teeth, eating, shaving. Shaving will be a little bit hard, so if somebody can help you, that would be a good thing. But you want to practice things so you know how you're going to be. Do all your laundry before surgery. Try not to have to do that kind of stuff after surgery, because think about it. You're not going to be able to fold easy. So if you have all of that done or someone to help you, that'll make you feel better. You don't want to be anxious after surgery. Eating and dressing, there it is. Before surgery, freeze healthy prepared meals. Eat food that does not need to be cut with a fork and knife. Or with a knife. If you can use a fork, that's fine. But maybe things like, healthy mac and cheese or some kind of pasta or something that you wouldn't have to worry about cutting up so much. Wear loose-fitting pants and tops. You really, when you get dressed, you're going to have to leave your arm by your side and use the other arm. If it was this arm, that same thing. So the rule of thumb is move the clothing, not the arm. So you're going to put that on your arm, but you're not going to be moving your arm until you go to put it in the sling. So when your arm is out of the sling, you want to leave it by your side, or if you're sitting down, you could have it propped up in your lap. Okay? How to wear your sling. So when you are wearing your sling, you want to make sure that your elbow is all the way to the back of the sling. You want to make sure that you don't have wrinkles in the sling. And you want to make sure that your hand is slightly higher than your elbow, because gravity brings swelling down. And if your arm is always like this, you're going to have swelling in your fingers, in your arm, and that's not going to be good because it's going to be hard to move. So if you have your hand slightly higher than your elbow, that's going to help drain some of that fluid. Okay, so those are good tips. The surgeon's going to tell you how long to wear it. Normally, you wear it at all times except for showering. Okay, and when you shower, you're going to leave it at your side, and you're not going to use it to help you shower. Okay. And when you're dressing, you're going to have to take it off. And then once you've finished with that arm and you have like your shirt on, you're going to put it back in the sling. So it reminds you not to use it. Okay. Showering and using the bathroom. When able to shower, if you can use a shower chair, that's really a good idea because you might be off balance because of your arm. You want to let it stay by your side or you want to have it in your lap. And you should have somebody nearby for safety. When using the bathroom, make sure the toilet paper is nearby. I mean, those are simple things, but it'll be frustrating if you don't do that. Do not put weight on your arm to rise from the toilet. So if you need to get a raised toilet seat with handles, or you need to get maybe a commode to put over just so you can use the side to get up and down easier, that might be something to think about. Practice. So right now, before you come in for surgery, practice things. Practice having the arm you're having the surgery on, keep it close to your body. Practice getting on and off the toilet and where's the toilet paper so everything is ready for you when you do go back home. These are some exercises that the therapist is going to show you while you're here, and I'm going to just tell you them, but I'm going to let them, when they're here, show you. So the only exercise you can do with your shoulder is called a pendulum exercise, and really the pendulum exercise, you're not actively moving your shoulder. That's more your body is going to move it. So you're not actively moving that shoulder. The elbow would be things like this or like this, not out here, only like this and like this. And they're going to show you these things. Wrist and hand, a good exercise to do with your hand is to do this because that helps pump the fluid back. You can use a rolled up ball of socks, or you can use a ball in your hand to help you with that. And then the neck exercises, they'll have to show you that because I'm not good at that stuff. But the wrist, you can go like this, you can go like this, but those are exercises that they're going to show you when they're here. Positioning. It's really important when you're positioned, if you're sitting in your bed, laying in your bed, or you're sitting in a recliner, that when your arm is like this, your arm is not doing this. See how my elbow slipped back? I'm actually moving my shoulder. You don't want that. So if you can see the picture of the person laying in bed and that they have that pillow underneath their arm, you can see that their elbow is like this and not like this. So if you're laying in the recliner or you're laying in bed, if you want to put a rolled up towel or a little cushion under your elbow to keep it straight, that would be the best thing. Many people find it more comfortable to sleep in a recliner, but that's totally up to you. And it's a lot easier to get up and down from a recliner if it's a recliner that's electric. So if you've always wanted a recliner, this might be a good time to purchase one. And think about this. You might say, oh, I have a really good recliner, but where is the lever? So if this is the arm you're having done and the lever is on that side, you're not going to be able to get in and out very easily. So as long as you have somebody there that can help you get in and out of the chair, that's okay. But just things to think about. That's why it's really good to practice, look around, see what you have for furniture, what you could be getting. If you don't have any little pillows, you might want to use the towel underneath the elbow to help keep your arm straight. But prepare before you come in for surgery. And that's actually it for me. My phone number is right here. Feel free to give me a call at any time. Hopefully this video was helpful to all of you, but just know that I'm here for you and that you can call me with any questions. And best of luck for your surgery.